skilled care nursing home facilities, of which Long Beach has many across the city. And so this is a serious issue, and I think it's important for us to recognize that these facilities, as noted by Governor Newsom and LA County, are a high priority for the city, which is why we have a long list of rules and orders as they relate to these places. We've been releasing additional data and information since last week about these skilled care facilities. There have been some questions about when we will be releasing exact locations and how many deaths are at each location. That information will be released beginning tonight. I think at the last discussion we mentioned that we would be releasing more info, or last week we said that, and so that additional information will start being released tonight. And of course, it's a very, very delicate issue because there are privacy rules and health privacy rules around that. And so I know there's been questions from the media about that, and so that's going to be released. So there'll be full transparency, and I've been asking for that as well. Around these nursing skilled care facilities, it's important to know that we are now testing everyone in these locations. So whether they're symptomatic or no symptoms, whether they are a resident there or they work as staff, we're going out and testing everyone. We think that's important. We're providing PPE to many of these locations and have been, we'll continue to do so. So let me talk about testing. Currently, we have 4 active COVID-19 testing sites in Long Beach, and we've talked about those in the past. Long Beach City College, the Pacific Coast campus, we have St. Mary Medical Center, Jordan High School in North Long Beach, and Cabrillo High School out in the western side. Out of these 4 locations, we have tested about 4,300 individuals in these drive-through testing. When you combine the private lab testing we've been doing, it's been about 9,100 individuals in Long Beach have been tested as of today. So 9,100 total. 43 of those have been through our drive-through testing locations. We know that testing is available and has been now for a few weeks, but we're opening up more testing. And I want to talk to you about 2 of these sites that we discussed on Monday and give you more details. Number 1 is we had mentioned that we would be opening an additional North Long Beach site. And so beginning tomorrow, our new North Long Beach site will open. This is a partnership with Governor Gavin Newsom and the state. And this new community testing site is launching at Jordan Plus. So Jordan Plus is part of the Jordan High School family, but it's in a different location, even more to the north. It's at 171 West Borch Street in North Long Beach. So Jordan Plus will be the location of our second North Long Beach site. So there will be a testing site at Jordan High School and at Jordan Plus. Jordan Plus will be one of 80 testing sites across the state. That's a partnership with the state of California, the County of Los Angeles, and us. This testing site will have the capacity to do significant testing beginning tomorrow. It will be able to do about 130 tests a day to start. And here is a key difference which we want people to be aware of. Tomorrow on April the 30th and Friday, May the 1st, these next 2 days, this testing site will be by appointment only and will test folks whether they're symptomatic or not, as long as they're frontline workers. And so these are frontline workers, first responders, healthcare professionals, critical government personnel, and grocery workers. So ideally is symptomatic folks, but I believe also, Jake, correct me if I'm wrong, but also non-symptomatic as well. So anyone that wants a test should be able to get a test. And we're going to put information on our website tonight for folks that want to get that testing tomorrow. The number for that, if you are one of those frontline workers, is 888-634-1123. That's 888-634-1123. But to make it easier, we're going to put it on the COVID-19 website tonight, and folks can start calling that number for the next 2 days if you are a frontline worker. Then beginning on Monday, May the 4th, the Jordan Plus site will be open to everyone, just like the other testing sites, which are essentially folks that are symptomatic first and foremost, and then there will be triaging that happens on the website to see if you qualify for one of the exams. So the Jordan Plus site will also be operating at the COVID-19 website. And just like today, you can go and link one of the other sites, that Jordan Plus site will be added to that. And that will be the additional site, and that'll be the 5th site. The Jordan Plus site will be open to all again starting Monday. And then, of course, we're opening up our 6th location. And that 6th location will open up starting on Friday. And that is at the Long Beach City College East Long Beach campus, which is a liberal arts campus, and it will be at Veterans Stadium. So Vet Stadium, which we know is the big stadium, the football field adjacent to Long Beach City College, which is part of the college, that will be the site of our new site. And just to make sure I correct myself here, this Long Beach City College site will open on Friday, and appointments will start tomorrow. And so people can start going on the COVID-19 website starting tomorrow, and we'll be able to start signing up for appointments for Friday. So we have the Long Beach City College site on Friday. We also have the Jordan Plus site for essential workers tomorrow and Friday. And then, of course, that site starting on Monday opens up for everybody. So once we hit Monday, we'll have the capacity in Long Beach to do over 1,000 tests a day. And that's something we've been building towards. I'm proud of the team for getting there. We've acquired these tests. The city is investing in these tests, and I just want to thank everyone for getting there. So that's all the information. If you have any questions, go to longbeach.gov and hit the COVID-19 website to give everyone more information. So that gives everyone an idea on testing, and that gives us an opportunity to transition to economic recovery. So I want to first talk about what Governor Newsom said yesterday and align that with what Long Beach is doing. So yesterday, Governor Newsom, and I want people to know, Long Beach, we are working very closely with the governor and the state, with his staff, with him directly, and with his team in all the departments to get us through this time. He has announced 4 stages to economic recovery that he expects cities and counties to meet and to use as a guideline. Step 1 and stage 1 is about safety and preparedness. Step 2, and the second stage, is about reopening lower risk workplaces. The third stage is about reopening higher risk workplaces. And then his 4th stage is about ending the stay-at-home order and really reopening up the rest of the state. And so what are we doing in Long Beach? We are currently in Long Beach at stage 1. Stage 1 is all about safety and preparedness. And what I just talked about with relates to testing is all about stage 1. Testing is about staying home and flattening the curve, which we're doing. It's about mass testing, which we're now getting to over 1,000 a day. It's about making sure that we have enough PPE, ventilators. Thank you, Virgin Orbit, just delivered ventilators that they were making here at our Long Beach plant to all of our local Long Beach hospitals. We have other ventilators that have been acquired through our amazing work of our hospital system. We've opened up a field hospital at the Long Beach Convention Center. We have opened up an expanded hospital capacity at our main hospitals in the city of Long Beach. And so all of these things that we've been working on, these are all part of this stage 1 of safety and preparedness. And so we're in the midst of this part of the governor's plan and of our own local plan. And so we are now also working to prepare sector by sector guidelines for safe reopening. How are we doing that? We have an economic recovery advisory group headed by our former Mayor Foster, who is providing input on how we do these guidelines to our health professionals and to the city. We have the City Council, which is holding hearings and forums with business owners and the community. And we have, which we just put out yesterday, a new survey that is our Reopen Long Beach survey. And if you haven't had a chance to participate in that yet, that survey, which we just put out, is an opportunity for every resident or small business owner to give us input on how we reopen. We have already received over 6,000 responses in less than 24 hours. The survey allows you to note if you are a worker, if you are a small business owner, and then answer a series of questions about what you think can safely reopen, and give us your ideas. We think that small business owners are going to have the best and most innovative ideas on how to reopen their small businesses. So we want you to take the survey. And we already have 6,000 people that have signed up. If you want to take the survey, again, you can go to the longbeach.gov website. There's a /Reopen Long Beach. You can take the survey from the COVID-19 website on the economic development section. And we'll also put a link right on the main website. But that survey is also part of this stage 1, which is allowing us to gather data to ensure that we're opening up the economy in the right way. And so stage 1, safety and preparedness, we're there. I am proud of the work. We're achieving all the goals. And I want to thank the governor for setting those goals out. And so we're feeling confident that we're meeting our health priorities, our needs, and our testing requirements, and getting input on how we reopen and create these guidelines. That's stage 1. Now let's talk about stage 2. Stage 2 is where we are headed soon. And I said on Monday that we are weeks, not months away, and that's right, and that's correct. We are weeks away from what we're calling stage 2. Some of which we are fairly close to be honest, and we'll have announcements in the days ahead so that people know what to expect. What does stage 2 look like? The first piece of stage 2 is about partnerships. And so your city, the city of Long Beach, the city of Los Angeles, the city of Pasadena, which has its own health department, and the county of Los Angeles, which represents all of the other 86 cities. We have a group, we have a leadership team with Mayor Garcetti, myself, the supervisors in LA County to ensure that we reopen stage 2 as a region and as a county. It doesn't mean there won't be some differences between Long Beach and the rest of the county, but generally we're moving together. And so stage 2 is all about lower risk workplaces, and we're going to have announcements soon. But these types of workplaces are going to gradually reopen. And this is some of the examples of what the governor has laid out for this stage 2 include low density retail, so smaller retailers that maybe could do curbside pickup or could really minimize the amount of people within their small store. It includes open recreation and opening up more public spaces, like our larger parks and open spaces. It includes manufacturing, which we know can be done safely, and is being done in some instances to create the PPEs and ventilators and other things that we need as a community. And so these areas, this idea of low density retail, of open recreation, of manufacturing, all fall into the governor's stage 2 plan. And Long Beach right now, as I'm giving you this update, we have the smartest people in the city working on how we get to stage 2 soon. And we're not going to rush it. We're not going to open for the sake of opening, but all these decisions will be guided by the advice and the leadership of our amazing health department and our health professionals like Dr. Davis, our health leaders, and our experts. So they're the folks that we're listening to on the dates of when this happened, but we're all have the consensus that we are on our way to stage 2 right now, and we will have more, I hope, some very hopeful announcements about what stage 2 looks like in the days ahead. And so that's Governor's stage 2, and which we are headed towards. And again, as a note of caution for us, please remember that we're not going to rush. We're not rushing this process, and we're not going to move quicker than the advice of the governor, our county and city health officials. They're leading this process as they should be. And once we get to stage 2, which we know is on the horizon, once we get past and reopen that first group of smaller businesses, open recreation, we will then take a pause. So I just want folks to understand that we're not going to rush right into the next stage, which is stage 3. But we'll take a pause and then review how we're doing. Well, what our hospitalizations look like? Is the positive rate going dramatically up? Have we lost more people to COVID-19? Are we able to manage the spread? Those questions will need to be asked before we move beyond that second stage. And that's what is important to health officials, is to reopen and then to test, verify, look at data before we move on to stage 3. And once we've had been able to look at that, what does stage 3 look like? Stage 3 is higher risk workplaces. And that is something that's going to be much more difficult, but something that we're already discussing how we do that. What are higher risk workplaces look like? Some of these include possible sporting events, but maybe without live audiences. More of the personal care that I know so many of us are looking forward to, like nail salons, gyms, barbershops. I'm fortunate that my husband cuts my hair, but I know that not everyone has someone at home that is able to do that. And so all of those types of businesses, we know that restaurants are also a location in a higher risk workplace, but we want to get there. Those are places that we're planning to get to right now. And then his final stage, stage 4, is the end of the stay-at-home order. And the types of things that we have to look forward to in that stage, after we get past stage 3, and again, test and verify and test capacity, those are concerts. Those are conventions, which in Long Beach are critical. Our convention center, our hotels are important to our economy. And of course, sporting events and larger concerts and larger venues. That's the last stage, one that we're nowhere near, and we have to be honest with ourselves. We are nowhere near in the next few weeks or months going back to live sporting events or having conventions in our city, large conventions in our city. We are going to try to work towards that in that stage. And so I wanted to review those 4 stages with you so that you heard it honestly, that we're aligning with the governor. We are in no rush to rush through this, but to have hope that we are meeting and have met our stage 1 goals. We're verifying those with the state. They like what we're doing, and now we're moving on to stage 2, and you're going to hear a lot about stage 2 in the days and weeks ahead. And so I want to, before I transition over to Dr. Davis, I just want to give one last update, and that is that we want people to have health care. And while we know that not everyone in the city has access to health care, we want to make sure that residents who are eligible for Medi-Cal or Covered California, or as some folks know it, Obamacare or the Affordable Care Act, these are also state-operated programs, of course, and our city is committed to helping you sign up for them if you don't have access to health care. We are ready to walk you through signing up for one of these plans, 8 a.m. to 5 p.m. any day of the week, by calling 570-7979. Again, you can go or just call, you can even call the info line, which we have the 570 info line. Call the health department in Long Beach, go to the health department website. We have enrollment counselors that speak English, Spanish, Khmer, and we're ready to help. We want to get you health care. And as a final note, if you don't have health care or insurance, you're undocumented, you need support, you can visit our rapid response clinic at the Long Beach City College Pacific Coast Campus site any day to get assistance. And I want to thank you again for being patient with us, for following our Safer at Home orders, and to our partners at Long Beach Unified School District and at City College for opening up these sites. Thank you again. And with that, I want to turn this over to Dr. Davis.
Thank you, Mayor. Good afternoon. I'm going to talk about cleaning surfaces today. Families and individuals across Long Beach are doing their part to prevent the spread of COVID-19 by staying at home. Thank you for that. And washing their hands often for 20 seconds and maintaining physical distance. Another way that we can prevent the spread of COVID-19 is by cleaning and disinfecting high-touch surfaces. High-touch surfaces include tables, doorknobs, light switches, cabinet handles, desks, toilets, faucets, sinks, and electronics. So first you want to clean the surface with soap and water, and then you want to apply a disinfectant after that. Cleaning with soap and water decreases the number of germs that are present, and then disinfecting kills the ones that are left. And you can use regular disinfection products like Lysol. Those are sufficient to kill the virus. Unfortunately, the increased need to clean and disinfect surface has also created some unintended consequences. Since the COVID-19 pandemic began, calls to U.S. poison control centers about harsh cleaners and disinfectant exposures have increased by 20% compared to the same time last year. So I'd like to share some information about how to safely use these items to both prevent the spread of the virus and to stay safe from any harmful effects of the chemicals. First, it's important to always follow the label directions. For example, products like Lysol or Clorox wipes often require that the surface remain wet for a certain amount of time to be fully effective. Don't mix chemicals. Certain products can create toxic gases when they're mixed together and can be very harmful. One of the examples that the CDC gave was somebody was washing their groceries with bleach, and some kind of gas formed and actually made the person faint. Some products can cause skin, eye, or respiratory irritation, and you can protect yourself by wearing gloves and using cleaning products in a well-ventilated area. And you can increase the ventilation by using a fan or opening a window to make sure that the fumes don't congregate or just stay there and create a problem. Additionally, there's no evidence that sunlight, bleach, or any disinfectant can cure coronavirus in the body. Don't ingest or inject bleach, rubbing alcohol, or other disinfectants. This can cause serious health problems, including death. Store all cleaning products and chemicals out of reach of children. Another example that the CDC gave was a preschool-age child who drank a large amount of ethanol-based hand sanitizer, and ethanol is alcohol, and so she ended up with alcohol poisoning. And finally, while we certainly don't want accidental poisonings to happen, it's important to have the number for poison control handy just in case. It can be helpful to keep it on the refrigerator or in some other visible, easy-to-see area. The number for poison control is 1-800-222-1222. 1-800-222-1222. Thank you.
Thank you, Dr. Davis. We'll go ahead and I'll turn it over to Jake, who now has questions from the media.
All right, thank you, Mayor. So the first question is coming from Rachel from Channel 7. Rachel, go ahead with your question.
Hey, thanks. So since we're now weeks, not months away from, I guess, easing into reopening, is there any apprehension or fear from public officials about a spike in cases if we begin reopening in the coming weeks? And if there is that second wave that everyone seems to be talking about, is the city prepared with a plan as to how to respond to that next outbreak?
Yeah, I think we can both answer that. I think the answer to that is yes. I think we know that any level of reopening carries risk. So there is no way to ease back into any type of reopening plan without some level of risk. It's about minimizing the risk as much as possible and doing it in the most safe way and using the advice of our medical officials and guidance to do so, and not just because we might feel a certain way or miss a certain activity. That's the way I view it. So we are prepared for that, which is why you have to also open in phases. So you open up, and that's why that stage 2 talks about just a few of these kind of areas, clusters, and then you test, you wait, you observe, and are prepared to pull back, and if you need to. Did I capture that, Dr. Davis? Did you have to want to add anything to that, or?
Nope. No, we'll monitor really closely. We open up in phases. We let the data tell us, whether we need to go forward or backwards.
All right. Thank you, Mayor. Thank you, Dr. Davis. The next question is from Kelly from the Long Beach Post. Go ahead, Kelly.
Yes, hi. A question for Dr. Davis. We reported today that Broadway by the Sea has had 11 deaths of coronavirus in that facility, and wanted to see if Long Beach could speak specifically on how they're working with the Broadway by the Sea facility and this outbreak there. And I know the governor has talked about sending strike teams to certain high-risk facilities. If you could just talk a little bit more about the situation in Broadway by the Sea and what Long Beach is doing.
So thank you for the question. We're working really closely with Broadway by the Sea to identify at-risk individuals and staff, get them tested as quickly as possible at our public health lab, to cohort or isolate individuals, both residents and staff. So that takes a lot of time and effort and planning to make sure that everyone's in the right place. And then really adhering to the long-term care facility order, which entails numerous best practices such as screening all staff and residents every day, making sure that ill healthcare workers stay home, making sure that they have enough PPE. We're on a regular basis delivering PPE to the facility, education, both in person and virtual. So just kind of a all hands on deck, very aggressive intervention and working with them, as well as other long-term care facilities who are also having confirmed cases.
Thank you very much, Dr. Davis. The next question is from Haley from the Press Telegram. Go ahead, Haley.
Yeah, I actually have two questions. First of all, I just wanted to know whether Long Beach is considering extending its safer at home order. And then second, Mayor Garcia, you mentioned that there would be a pause for stage 2 to review, how it's going. So is there like a minimum time frame for how long you would expect stage 2 to last before moving on with stage 3?
Well, I don't think there's any sort of time frame laid out. I think that'll all be guided by the medical professionals and the data and how the first kind of phase of reopenings go. I think it's really important that any person in a position of leadership at any elected level is listening and making decisions and allowing the medical and the professionals to be making the decisions and providing the kind of roadmap as it relates to the timing of reopening. The how we do the reopening and the best ideas and the best way to do it, where a lot of us are working on that. But everyone, and I know this was the case for Governor Newsom and governors across the country and mayors, is we're all listening to our medical advisors and professionals. And so as far as the timing has not been roadmapped yet. So there is no exact roadmap as far as the May 15th date. We're very aware that May 15th is currently the date of our safer at home guidance and order. We obviously know that date is coming. And so as far as what happens with that date, what I can share is whatever happens with that date, and how we move into stage 2 is being coordinated with our partners at the LA County Health Department and at Pasadena Health as well. And so this is a joint conversation. And then as far as the amount of time between, we don't know. It's all going to be all about testing. I think I covered the question. Did I get that right, Dr. Davis?
All right, the next question will be from Jeremiah from the Long Beach Post. Go ahead, Jeremiah. All right, it sounds like Jeremiah might be having some challenges. Jeremiah, if you pop back up, just go ahead and raise your hand and we'll go ahead and contact you. Mayor and Dr. Davis, here's some questions that we're getting in regard to our Facebook live streaming, and I just wanted to follow up with you on some of these things. And I would probably start with the mayor on this question. Why are we opening up so many testing locations throughout the city?
Well, we're opening up testing locations because part of reopening up and getting back to any semblance of normalcy is mass testing. And so we have to have more testing. And we were testing poor at the start. I think we were all waiting for tests. We had to ramp up ourselves. We ramped up testing. I would argue that we have now a very robust testing program in the city. Over 1,000 a day is going to be important, but we're going to try to even do more. And we know that now we've expanded testing. It's people that are asymptomatic. We're also now testing non-symptomatic frontline workers and working with other clusters of individuals to get tested. And eventually, I think we all want to get to a place where we can start testing folks that have shown no symptoms and that are not essential workers. And we also want to get to a place where we are doing the antibody test. As Dr. Davis has said many times, the antibody testing to do in a way that's not a controlled research project is not reliable right now. We have research institutions and universities doing tests, sampling around the country of different types of tests. But once we roll that out in Long Beach, we've got to make sure it's right. We can't put out an antibody test that tells someone that they have the antibody, but we don't know what that means as far as getting reinfected. Or we tell someone, oh, actually, they might have the antibody and the test comes back negative. So there's a lot of concern there. I've learned a lot from Dr. Davis on that issue and others. And so we want to ramp up testing. We'll continue to do so.
And I just want to add that as we shift into phase 2 and start to open up businesses and what have you again, we do expect more exposures. So it's going to be really important to have really fast, easy testing in your own neighborhood that you can access. So that's another reason to get it all up and running.
Yep. All right, we're going to try Jeremiah again. Jeremiah, go ahead from the Long Beach Post. Looks like we're having some technical difficulties. Jeremiah, if you want to send us your question, we will go ahead and ask your question on the chat box feature. Moving forward, in addition, additional question relating to the process and stages. And obviously, a lot of people on the Facebook feed have questions relating to where does my business fall into these stages. And some of those questions relating to child care centers and orthodontists and or dentists. But one of the questions we get over and over again is about preschools, summer camps, and schools, because obviously, in order to get back to work, that's a big deal for many families that are really struggling through this process. And so they'd like to have some conversation, some guidance from that. And in addition to that, with summer coming up, what specifically is happening about Long Beach City summer camps as well?
I think we're going to have a lot more information about industry-specific clusters, in the weeks ahead. As it relates to schools, I think that obviously the governor has made some announcements about timing, but we know that those decisions really are made also at the local level. It's really the local school district, Long Beach Unified, that is working just so hard right now to get the reopening process right. They want safety first, and so we look forward to working and partnering with them and Cal State Long Beach and Long Beach City on what fall is going to look like. As soon as we know this kind of sequence that is going to be really laid out by the advice we get from the public, from the Economic Recovery Group, and really the decision making and the real meat and potatoes of it's going to be decided by the health professionals. We'll have a better, clearer picture. What I will tell you is that we know that, and people can expect that we're going to start kind of naming industries or clusters that will be first to open soon. And I think that's something that we're working towards right now with our partners at LA County Health and Mayor Garcetti and the governor.
All right, so we do have the question on the chat box from Jeremiah here. So this is from the Long Beach Post, and it says, will the number of deaths be released for all long-term care facilities or just skilled nursing homes? And we've been told some institutional medical settings like locked mental health facilities aren't considered long-term care facilities. Why is the city not releasing the number of cases at those types of institutions?
I don't know the answer to that. Can you answer?
I mean, I would say that it's in discussion. Do you have information about the deaths? Or
From what I know, about the deaths is whatever LA County is doing, whatever format they're releasing theirs in, from what I understand, is Long Beach is going to mirror that or be close to that format. And so that'll tell folks, the skilled nursing home or the facility and the amount of deaths. So I'm not beyond that. I'm not sure. I wouldn't have the answer to that. I don't know. Do you feel anything differently?
No, I think that there's active discussions to align with LA County. So you should be seeing more information like later on tonight and tomorrow, as the mayor mentioned before.
Thank you, Mayor. So thank you, Dr. Davis. Now, moving forward into some of these other questions, one question that I'll have an answer for, because we had our team researching this that popped up on Facebook, but there was a question relating to essential workers for in-home caregivers, and that was relative to the question about the Jordan Plus site. And yes, in fact, home health care workers would be considered essential for asymptomatic testing. So we want to make sure we get back to our viewer that had that question. And then another question said, a viewer stated that the link was dead and wasn't working on the site. And we want to make sure everyone understands the link for the site, the state testing at Jordan Plus, it will be coming soon. However, we want to encourage you to call the phone number initially, as the mayor stated previously, for asymptomatic testing for essential workers on Thursday and Friday. But starting Monday will be the testing to the community. So, Mayor, this is one of the questions.
Jake, let's give the number one more time.
Absolutely.
Do you have the number there?
See it.
ASIM for the Jordan Plus site? I have it somewhere here.
Give that number here very shortly. Give us 1 second.
So if you are a frontline worker, first responder, healthcare professional, grocery worker, and you want to get a test and you have no symptoms, you can call 1-888-634-1123. That's 1-888-634-1123, and you can get a test tomorrow or Friday. And then everyone else can get that test starting on Monday. But again, the restrictions will tighten some because we're going back to mostly folks that are symptomatic. But for asymptomatic individuals, those next 2 days, and just so that you know, some of this moves so quickly, the testing sites come online so fast, and so we're trying to just get the information out to you as soon as possible, knowing that we just got the kind of heads up to give this information from the state today, and so we are going to have that available starting online tonight. Will be the information at some point in the evening on the website with the number. You can call the number now, and the next 2 days you can get tested.
Mayor, this is kind of an interesting question, and there's a lot of feedback on Facebook that we're seeing, but it says, instead of dictating what businesses should be doing, why aren't we putting the responsibility on business owners to open their businesses but yet practice physical distancing? Stores like Target and Walmart, they're doing that, and the small businesses out here are stating that they're in trouble and they're really feeling the burden of this, and they feel like they should be given the opportunity to do that internally. Can you provide some guidance and direction on that?
Well, I think that, first, what's considered an essential business and not was decided early on by health departments in the state, and there's a lot of metrics, and I think Dr. Davis has mentioned, food service and access to groceries is a big part of that, which is why you have some of these larger stores like Target and others open. But as far as smaller businesses, the truth is look at if you were to walk down 2nd Street, It's business after business after business. If we just opened everything all at once, that would not be safe, regardless of whatever physical distancing protocols were put in place. And so it's got to be phased, and the health department has got to lead that approach. It just cannot be left for a patchwork. And so that's why it's being done through the health jurisdiction that is creating guidelines for each specific type of retailer or industry. There will be guidelines that we're expecting everyone to follow. Is that right, Dr. Davis?
Yeah, and we're really following the state. Like, they're the ones who have decided, like, what's a low risk, what's a high risk, and which type of business is in which phase. So we're following their lead with that.
Right.
Well, this will be the last question, and Mayor, this goes towards the impact that this has had on so many lives, but this is also about, we've had a couple individuals that unfortunately have had to cancel their weddings, and they're trying to get some guidance and say, where does my wedding fall into stage 3 or stage 4? I've had to cancel my wedding. Do we have any guidance on gatherings of 50 to 100 people? We're just looking for some additional help.
I mean, I think gatherings of any type with large amounts of people, I don't think are coming back anytime soon. I think that's.
Sorry.
I'm sorry too. It's just not happening in the next few weeks or probably this summer.
Yeah.
Now, obviously, we have civil weddings that happen that have been closed at City Hall, and we hope those, at least the giving of marriage licenses, giving of civil ceremonies, that should happen a lot sooner. But larger gatherings it's going to be a bit before that comes back, unfortunately.
All right, we did have one more question for Rachel Jordan. Rachel's asking here from Channel 7, will asymptomatic frontline workers be able to get tested at Jordan Plus after Friday, or Thursday and Friday? And our Thursday and Friday appointments are reserved for frontline workers at Jordan Plus? Was that the initial intent?
Yeah.
That's my understanding.
Yep. So frontline workers, grocery workers, anyone that's an essential worker out there that's working right now, nurses, you can go get an appointment at Jordan Plus tomorrow, Friday. Starting Monday, they're going to transition back to symptomatic individuals, but I will caution that these testing, who we're testing, it's a fast changing system, and that site, the Jordan Plus site, is a state-run site. It's a partnership with us, but it's really an initiative of Governor Newsom. He opened 80 across the state, and so could that change? It could, but we'll have information as it develops.
Thank you, Mayor. That's going to be it for the questions on our Facebook Live feed and from our media. So thank you very much for the feedback, and hopefully we answered some of those questions. And Mayor, I'll turn it back to you.
Great, thank you. And we'll do for those that speak Spanish, si hablas español, ahora vamos a tener un poquito de esto en español también. So gracias. Alice, thank you.
Muchas gracias, alcalde García y doctora Davis. Muy buenas tardes a todos y gracias por acompañarnos hoy en nuestra sesión informativa. Tenemos varias actualizaciones para compartir con ustedes, pero recuerden que esto solamente es un resumen en español. Desde hoy tenemos 629 residentes de Long Beach que salieron positivos del coronavirus. Lamento compartir de esto que en nuestra última sesión informativa de lunes hemos perdido a 3 residentes más de Long Beach por esta enfermedad. Eso eleva el número total de muertos a 36. Actualmente hay 4 sitios de prueba de autoservicio. Desde hoy hemos tenido 9,100 pruebas total. Eso incluye todas las pruebas de la ciudad y también las pruebas de los laboratorios privados. De todas maneras, desde esta fecha hemos completado 4,310 pruebas en nuestros 4 sitios de pruebas de autoservicio. Las pruebas están disponibles para personas con síntomas como fiebre, tos y falta de aliento. Para programar una cita para el mismo día o el día siguiente, visite longbeach.gov/COVID-19 o llame a la línea de información al 562-570-INFO. Sitios de prueba. Mañana se abrirá un nuevo sitio de pruebas de coronavirus en North Long Beach. Es un segundo sitio en North Long Beach. Tras el llamado del gobernador Newsom de California para agregar sitios de evaluación comunitarios en todo el estado que se centren específicamente en comunidades marginadas, nos orgullece anunciar el lanzamiento de un sitio de evaluación en Jordan Plus High School, que está localizado en el 171 Oeste sobre la calle Bort. El sitio Jordan Plus será uno de los 80 sitios de pruebas brindado por una asociación entre el Estado, el Condado y OptumServe. El jueves 30 de abril y viernes 1 de mayo, las pruebas se realizarán con cita previa solo para trabajadores de primera línea o como los hemos conocido, trabajadores esenciales, como socorristas profesionales de salud, personal crítico del gobierno y trabajadores de supermercados. Si quiere una cita para mañana o el viernes, por favor llame al 888-634-1123. Y estas pruebas serán para personas y trabajadores esenciales que tengan o no tengan síntomas para este momento. A partir del 4 de mayo, que es el lunes, los miembros de la comunidad que experimenten síntomas pueden utilizar el sitio de prueba de Jordan Plus también. Pero recuerden, solo mañana y el viernes es para los trabajadores esenciales solamente. El sitio abrirá de 7 de la mañana a 7 de la noche entre semana, solamente con cita previa. Este sitio tendrá la capacidad inicialmente de administrar 132 pruebas al día. Una vez que el sitio Jordan Plus y el nuevo sitio en el estadio de veteranos sobre la calle Clark en el colegio de la ciudad de Long Beach estén abiertos, la ciudad tendrá la capacidad de evaluar a más de 700 personas por día y además también las adicional 250 que se pueden hacer la prueba en el Centro Médico de St. Mary's. Cualquier persona que desee programar una prueba debe visitar la página de pruebas COVID-19 de la ciudad y responder varias preguntas de evaluación previa. Y otra vez, el sitio de web es longbeach.gov//COVID-19. Algunos datos de las etapas de recuperación económica. De ayer, el gobernador Newsom presentó un plan de 4 etapas para reabrir gradualmente el estado de California. Ya estamos en la primera etapa que ahorita se enfoca nada más en la seguridad y la preparación. Una vez que logremos disposiciones, podemos pasar a lo que es la segunda etapa, que es la reapertura adaptada y gradual de las empresas, que incluyen puntos de venta, oficinas y algunos espacios públicos. El gobernador también gustaría que las instalaciones escolares y de cuidado de niños se abrieran con adaptaciones de seguridad, posiblemente en julio o agosto para compensar el tiempo que hemos ya perdido durante el año académico actual. La tercera etapa implica la reapertura de los lugares de trabajo de alto riesgo, donde las personas se encuentran muy cerca unas a otras, como peluquerías, lugares de entretenimiento, lugares de culto. Es probable que no pasemos a la etapa 3 durante algunos otros meses. La cuarta etapa es el final, que es que cuando las órdenes de salud requieren que no nos quedemos en casa y la reapertura de lugares de trabajo y eventos de mayor riesgo como conciertos, sin la necesidad de modificaciones. Es tan importante que establezcamos un proceso estratégico que no nos ponga en riesgo a las personas y esperamos enfrentar cada uno de estos desafíos para reabrir completamente nuestra economía en asociación y consulta con el gobernador de California, la alcaldía de la ciudad de Long Beach, el grupo asesor de recuperación económica y el Departamento de Desarrollo Económico, nuestros socios de hospitalidad, funcionarios de salud y nuestros colegas del mundo y el país entero. La encuesta para reabrir la ciudad de Long Beach, como mencionamos el lunes, nos gustaría obtener algunas ideas sobre cómo reabrir nuestra economía local. Y ya hemos recibido más de 6,000 respuestas. La ciudad ha creado una encuesta en línea, Reopen LB, para proporcionar a los residentes y propietarios de negocios la capacidad de evaluar y darnos su opinión sobre cómo reabrir la economía local de una manera segura y saludable. La encuesta le hará preguntas como si se siente seguro para regresar al trabajo y qué actividades podría considerar de bajo riesgo en sus obligaciones de día a día. Los resultados serán recopilados y compartidos con la alcaldía de la ciudad y una versión de la encuesta en español estará disponible muy pronto para que usted pueda llenarla y dar sus comentarios y cualquier otra opinión que tenga sobre cómo podemos juntos reabrir nuestra economía local. Recuerden que cualquier decisión de reabrir se alineará con la orden del gobernador Newsom más seguro en casa y las órdenes de oficial de salud de Long Beach, pero los comentarios de la comunidad serán considerados como parte de nuestra estrategia. No vamos a apresurar este proceso sin las pólizas de nuestros agentes de salud pública. Queremos recordarles que no queremos apresurarnos mucho porque sería empeorar si abrimos completamente y luego tenemos otra orden para tener que cerrar otra vez todos los lugares públicos. El enlace de la encuesta también se distribuirá a través de múltiples canales, incluidos el correo electrónico, las redes sociales y varias organizaciones comunitarias. Además, nuestro Departamento de Salud de Servicios Humanos ofrece asistencia a inscripción de los residentes que son elegibles para Medi-Cal y Cover California. En estos tiempos difíciles queremos asegurar que todos los que han perdido trabajo, su seguro médico, tengan la oportunidad de aplicar para su seguro médico lo más pronto posible. Ambos programas de seguro operados por el Estado ofrecen acceso a atención primaria, tratamiento de emergencia y servicios de salud mental a todos los que califican. Nuestra ciudad de Long Beach está comprometida a ayudarle a registrarse a usted y a sus familiares para que tengan atención médica. La ayuda está disponible de 8 a 5 de lunes a viernes. Y el número para llamar para asistencia es 562-570-7979. Los consejeros de inscripción hablan español y también pueden enviar preguntas por correo electrónico a coveredlb@longbeach.gov. También queremos hablar poquito sobre la limpieza de superficies. Las familias y las personas en Long Beach están haciendo su parte para evitar la propagación del coronavirus al quedarse en casa, lavarse las manos a menudo durante 20 segundos y mantener la distancia física. Otra forma efectiva de prevenir la propagación del coronavirus es mediante la limpieza y desinfección de superficies de alto contacto. Las superficies de alto contacto incluyen mesas, promos, puertas, interruptores de luz, gabinetes, escritorios, inodoros y dispositivos electrónicos. La limpieza de superficies con agua y jabón es una forma efectiva de eliminar las superficies del virus. Desafortunadamente, la creciente necesidad de limpiar y desinfectar superficies también ha creado algunas consecuencias no deseadas. Desde que comenzó la pandemia, el coronavirus, las llamadas a los Centros de Control de Envenenamiento de los Estados Unidos sobre limpiadores fuertes y exposición a desinfectantes han aumentado un 20% en comparación con el mismo periodo del año pasado. Por lo tanto, me gustaría compartir información sobre cómo usar estos artículos. Primeramente, es importante seguir siempre las instrucciones de la etiqueta. Por ejemplo, productos como Lysol y cloro requieren que la superficie permanezca húmeda durante varios minutos para ser completamente efectiva. No mezcle productos químicos. Ciertos productos pueden crear gases tóxicos cuando se mezclan y pueden ser muy dañinos. Algunos productos pueden causar irritación de piel, los ojos o las vías respiratorias y puede protegerse usando guantes y productos de limpieza en una área bien ventilada. En un ventilador abra una ventana para asegurarse de que los humos no se conviertan en un problema. Además, no hay evidencia de que la luz solar, el blanqueador o cualquier desinfectante puedan curar el coronavirus en el cuerpo. Por favor, no ingiera ni inyecte alcohol, cloro o algún otro químico de desinfectantes. Esto puede causar serios problemas de salud y hasta la muerte. Guarde todos los productos de limpieza y productos químicos fuera del alcance de los niños. Y finalmente, aunque ciertamente no queremos que ocurran envenenamientos accidentales, es importante tener a mano el número de control de envenenamiento por si acaso. El número para El control de envenenamiento es el 1-800-222-1222. Puede ser útil mantenerlo publicado en un lugar visible, como en el refrigerador, junto con otros contactos de emergencia. Muchas gracias. Es todo por hoy.
Thank you. Muchas gracias. And actually, I'm going to go ahead and clarify one piece of the testing question that we got from a member of the press. Like I mentioned, oftentimes information moves very fast. And as we're setting these up, so it's moving even as I sit here. And so I just want to clarify something, which I think is actually really good news. So beginning on Monday, both the Jordan Plus site, which is the site that's being opened by the state, and the Long Beach City College PCC site, which is the site that, of course, is run by the city, both of those sites will be taking the non-symptomatic frontline workers. And so the goal, of course, is to eventually test everyone. And so just to clarify, if you are a nurse, you're working in a grocery store, you're working in a medical office, you are, I think Jake had mentioned, a healthcare worker, a home worker that is on the front line working right now, you can start getting tested at Jordan Plus tomorrow and Friday and Monday through Friday for the foreseeable future at Jordan Plus. But starting on Monday, you can also get tested if you are asymptomatic and you're part of one of those groups at the Pacific Coast campus at Long Beach City College. So we will have 2 sites for all, whether you're symptomatic or not and you're a frontline worker. And then, of course, if you're symptomatic, you can go anywhere, anytime. And then the only category we haven't gotten to yet, of course, is if you are a non-essential, non-frontline worker and you have no symptoms. We're asking those folks to first let all the other folks go first. So we'll get to those, all of you, at some point soon as well. And so wanted to clarify that. I think it's an important distinction, and I'm just getting the information right now as we sit here. So thank you again, and we will have our next update on Friday. Thank you.